Hello, everybody. It is that time again. One of my favorite things to do, and that is to have this session that is Ask Dr. Bob. And that's where you, people with diabetes and those that care about them, get to ask me, Dr. Bob Gabe, the Chief Scientific and Medical Officer for the American Diabetes Association, questions about diabetes. What do you want to know? And for those of you that have been joining us regularly on a monthly basis, you know that what we do is we tend to pick a theme. And this theme today is going to be about COVID and diabetes, and more specifically around vaccines. There are lots of questions, and I'm really glad that people are asking questions. This is an important topic, and let's get started. So I have, as I said, a bunch of questions. So let me sort of get started with the first piece broadly about COVID is um, what is what environment is it that's most prominent to spread COVID? Um, and and here's where I'm going to start with just sort of like the big picture and the principles, and then I'll give you some specific examples. So what we know about the COVID-19, it is primarily spread airborne, meaning it's in the air. And it's in the air when we talk or breathe, and so it sort of comes out like that. Uh, that's where this idea of being 6 feet away, because it starts to dissipate the further away you are. Um, so the first piece of principle is any place where you're going to be closer than 6 feet from somebody, because if you follow, they've actually done experiments where they can follow the spread of the droplets from your mouth when you breathe or talk, and pretty much they sort of dissipate, spread out, and are very few once you get 6 feet away. That's where the 6 feet thing comes from. So principle one, close quarters, where you're within 6 feet of other people, that's a riskier environment. The other is, since I said it's airborne, the ventilation is important. So if you've got a good ventilation system and it's blowing air, those particles aren't going to sit around in the air too long. They're going to be gone. And so ventilation, well ventilated, is number two. Um, and then number three sort of comes from that ventilation thing. I like to think of, imagine the ventilation in a big open space versus a really confined area, low ceilings, very confined. Well, there isn't a lot of ventilation. The air is not moving around a lot. In a big hall, there's much better ventilation. So those are the three principles: close quarters, little ventilation, and sort of low ceilings. So now, where does that play out? What kind of places might that be? Well, schools can be an issue if children are within 6 feet of each other. So that's something to keep in mind. Um, Going to a show or a movie if you're less than 6 feet from people. The good news is those tend to be big open areas, but still you may be shoved together. Um, where's a place that you really got to be concerned? Um, a crowded bar, right? Just think about it. You're, you know, closer than 6 feet away. 6 feet is like a body length. You could think of it almost that way. Um, and people tend to huddle together. Well, that's going to be a riskier place. Restaurants that have sort of low ceilings and very cozy, problematic. Restaurants that are really big and open. And here's a little interesting tip people don't think about: a restaurant with what's called an open kitchen. Because to have an open kitchen, they usually have a really good ventilation because they're sucking up all the smoke so that the restaurant's not smoky. That's probably a better place to be. So, those are some of the high risk places. Okay, let's go to the next question. Um, why? Oh, this is a good one. I'm glad somebody asked this. Why won't the vaccine prevent folks from getting COVID? We thought isn't that the idea? Well, No, it isn't. So this is what's interesting, and we'll talk a little bit later about how vaccines work. But these vaccines were really designed to prevent severe disease, not from catching the disease, but from having the really bad outcomes that happen with COVID. So if you look at what's happened, you can see how that makes sense. So lots of people are getting COVID, and it's obviously not stopping people from getting COVID, but the number of people that are getting severe COVID are far less if people are vaccinated. That's really the key. That's the reason to do it. So that goes to the next question. Um, you know, why get the vaccine? And it's really to prevent hospitalizations, going to intensive care units, being on a ventilator. People that are vaccinated are much less likely to have that happen than people that are unvaccinated. So that's the reason we recommend vaccinations. Uh, so here's the next question. Um, well, this sort of gets to the same thing. Why is it recommended that people living with diabetes get the vaccine as soon as possible? Um, since again, people who get the vaccine still get COVID. So, like, what's the point? And the point is really to prevent people from dying, from being on a ventilator. Um, and we now know that that's true. So if you go, you've probably seen in the papers that hospitals are filling, hospital and intensive care units are filling. Some parts of the country are running out of ventilators for people. If you look at who those people are that need that, most of them are people that are unvaccinated. So please get vaccinated. Think about that. Talk to your healthcare provider about that. So then this is another great question. Does it matter which type of vaccine I get? Well, I would say the best thing is to get one of the three vaccines. um, Pfizer and Moderna are probably a bit more effective than Johnson and Johnson. Doesn't mean that if you got Johnson and Johnson, you're in trouble. No, still a good vaccine, but Pfizer and Moderna are probably a bit better. And the good news is when it comes to getting a booster, which we'll talk about in a moment, it's you can mix and match between Pfizer and Moderna. So if you got Pfizer originally, you could get Moderna and vice versa. It doesn't matter. They both work. And we'll talk a moment about how these vaccines work so that you understand the way behind it. Okay. So, another great question. Does the COVID vaccine, get in the way of any diabetes medications or treatment? And that's an easy answer. No, nothing. Doesn't interfere with diabetes or diabetes medicines in any way. Next question. Will getting a booster shot make a difference? And people, you've probably heard this term breakthrough infections. Breakthrough infections are people that are vaccinated that still break through and get the disease. And so, uh, what we know is again, less severe disease. They may still get COVID, but that infection is a lot less worse. Why do we need boosters? So let me talk a little bit about how vaccines work, and I'll start just really broadly vaccines in general, and then we'll talk specifically about the vaccine for COVID-19. So the body's immune system fights infection. That's a natural thing that we all do. Uh, When we are exposed to a virus like COVID or bacteria, uh, the body has to make these antibodies to attack the foreign invader, the virus, and to kill it off. And normally that's what we do with all sorts of viruses and bacteria that come. Uh, the challenge is it takes time to make those antibodies and to make that response to fight off the infection. And during that time, particularly for COVID-19, people get really sick before their body's able to respond. What the vaccine does is it allows them to be exposed to a tiny piece of the whole virus. Not enough to cause an infection, not enough to make you sick. But imagine that you may have seen the pictures of COVID-19. This big ball with little colored spikes on it is sort of the picture that we happen to see. They take one of those tiny little spikes, and they use that for the vaccine in essence. And your body makes antibodies against that, and now it's ready. um, it already is primed for if you're ever exposed to the infection, it's ready to attack that infection. So it doesn't stop you from getting infection, but as soon as you do, the troops are already there. So now we're going to move to some questions that family members have, and particularly around their family. Is the booster safe for children under 16? And I can say really we have a lot of information on this, tested on thousands and thousands of young people, and yes, it is safe and it is approved by the Food and Drug Administration. Um, the next question is, how do I protect my children in school and try to prevent them from getting COVID-19? Well, one is vaccination that we talked about. Two is wearing a mask. Uh, Three is distancing, staying 6 feet away. And those are really the three things. It's vaccine, mask, and distance, and that's true for all of us. The next question is, and I'll for those of you that are just joining, this is Ask Dr. Bob. I'm Dr. Bob Gabay, the Chief Scientific and Medical Officer for the American Diabetes Association, and I'm here to answer your questions. Throw them into the chat. We still have some more questions that people have already sent, so I'm going to get right back to it. Okay, so if I get COVID-19 after the vaccine, is it still likely to spread to my family even if I have no symptoms? Yes, it is. You can still spread it without symptoms, and that's part of why it's been spreading so fast, and part why now there is we're expanding. The nation is expanding the ability to test at home, so that you can know, because not everybody gets symptoms, and particularly young, healthy people often have no symptoms. So you can still spread it, and therefore you need to keep a distance from your family if you're diagnosed with having COVID-19, so that they don't get it, because many people have other family members that could be at much higher risk for bad outcomes from COVID. If I get COVID-19 and I have diabetes, should I go to the hospital right away? No. Yeah, fortunately, you don't need to, but there are some things you should think about. So, like any illness, you want to be able to recognize the signs of this being more severe. Because, particularly with Omicron, many people don't get really severe infections. And particularly those that are vaccinated, infections are usually mild. Usually, I say. Uh, but what you should look for is if you have high fevers for several days and it's not getting better, yeah, that's a time where, at a minimum, you should be talking to your healthcare provider. I'm not saying you need to go to the hospital. If you get really short of breath, yes, that's a very concerning thing. Think about heading to the hospital. And of course, always best to talk to your healthcare provider first, wherever possible. But if you're really short of breath, don't waste time, because breathing's important. Um, and then the other thing I'd say is, if your blood glucoses are really out of control, and they're in the 400s and 500s and you can't bring them down, yep, that's a time where you might need more significant medical care, may need to go to the hospital. And for people with type 1 diabetes, you're probably familiar with something called DKA, diabetic ketoacidosis. And that is when blood glucoses get high and you start feeling really sick, nauseous, vomiting, belly pain, things like that. If those are your symptoms, yeah, you need to go to the hospital. Okay, let's move on. Um, what are some best care practices to implement when I'm recovering at home? So that's a good question. You're not sick enough to go to the hospital. How do you manage COVID at home? Well, first, plenty of fluids, like you would for a cold in general. Um, uh, Something for fever, whatever you would normally take, and talk to your healthcare professional. Tylenol, Motrin, Advil, those kinds of medicines, anti-fever medicines. And then depending on what your symptoms are, over the counter treatments that, target that. So if you have a lot of nasal congestion, something for that. If you're coughing, some cough syrup. Um, and to be honest, those are good things to have stocked up at home right now before you get ill, just so you have them handy. Uh, and the other important thing to do for people with diabetes is if you do get COVID, start monitoring your blood glucoses more frequently, because the infection can drive up your blood glucose levels. And so it's important that you know where you're at, so you'll know if that happens, and be able to take the right precautions and be able to give that information to your healthcare provider. Okay, so now we're going to get into, there's some questions about testing. And so the first question is, I heard that if you swab your throat with COVID test at home, you'll be able to receive accurate results. And is that true? Well, there are a number of home tests now, and I think this is fantastic. It really makes it easier for people to get testing. Uh, Most of them work by putting a little Q-tip in your nose, and that's probably more accurate than the throat, but some of the throat ones and saliva ones can also be good. Uh, the next question sort of gets at the issue. So, why do these at-home tests give what's called false negatives? So, what's a false negative? It's when you test negative, but you're falsely negative. You're not really negative. So, in other words, I think I might have COVID. I do a home test and it says, no, you don't have COVID, but I actually do. Why does that happen? Well, let's get at what these tests are measuring. So, what they're measuring is in essence the amount of virus you have in your nose or your mouth, wherever you're measuring it from, how much virus you have. And every test has a level of what we call sensitivity, what it can detect. Um, and so where the home tests are best is if you're sick, and therefore you'll probably have a lot of virus showing up, and you check, you'll have enough virus on that Q-tip to be able to measure it, and the test will say yes, you have COVID. But early in the disease, you might just have a little bit of virus, but too low a level to be able to measure from the home kit, and that's why sometimes the home kit's not accurate. The test that's called the PCR test that you go to a pharmacy or a doctor's office or something to have, those are more sensitive. They can measure even lower levels of virus, and so those are sort of even more accurate. And so when in doubt, that's the best test, but the home test is pretty good. And certainly, if the home test says, yes, you have COVID, yeah, you've got COVID. And you need to take the precautions of separating yourself from other people and, quarantine, all of that kind of stuff. Um, okay, here is a really important area for people with diabetes and those that care about them. And the question is, I've heard that kids with COVID are more likely to develop type 1 diabetes. Is that true? It's starting to look that way. We've seen a number of new cases of diabetes develop in kids when they get infected, and so that is a concern. And we're also seeing new cases of type 2 diabetes. And so This is something we're following closely at the American Diabetes Association. We're actually funding research to try to understand how COVID may be causing this so that we can stop this. Uh, and if you follow me on social media, whether that's Twitter or LinkedIn, you'll see there's lots of information and posts that we're putting of research studies that are coming out. And the best source of information on all of this, because I'm trying to cover a lot of information in a short time, um, is the American Diabetes Association website at diabetes.org. That's where you'll find all sorts of information on COVID. Now I see that we have lots of other questions, so let me see about getting at them. So let me get up close. I apologize. Lilani asks, I got a COVID booster in September. Should I get a fourth dose? Good question. To be honest, we don't know the answer to that yet. For now, I would probably hold off. The Center for Disease Control and the FDA are studying this to see the safety of a fourth booster. On one level, you think, hey, why not? But it's always best to get this kind of stuff tested and vetted before making a move. So stay tuned, but it may be necessary to get an additional booster. We'll see. This is a changing story, as we all know. Uh, Billy asked, "Is there any correlation between COVID and gastric problems? I recently had COVID and still have stomach problems and pain in swallowing." Well, it's possible. So there is something called long COVID. You may have heard of this term. And that's what we're finding, that people that have had COVID can sometimes have some symptoms for a long time afterwards, even months. And a whole series of different things that are described. And so we're still learning more about it, but certainly it's possible, and always best to talk to your healthcare provider about those gastrointestinal issues and make sure that isn't the issue. Um, I'll finish off with one last question, and Gary asks if it's safe to take the vaccine and flu shot at the same time. And the answer is yes. And in fact, we like that idea because it's easy to remember. We don't want to forget about the flu vaccine just because we're in the midst of COVID. Flu still kills, you know, in any given year 80,000 people. And people with diabetes are much more likely to get severe reactions to flu compared to others. So um, it is worth getting the flu vaccine, number one. And number two, yeah, you can get them both together. And that's been looked at, and no danger in doing that. So absolutely makes life easier. One trip instead of two. Uh, so, with that, I want to thank you so much for all of your great questions. This is Dr. Bob Gabay, the Chief Scientific Medical Officer for the American Diabetes Association. Another episode of Ask Dr. Bob. Tell your friends and family about this. We'll see you next month. And between now and then, please stay safe, stay healthy, and take care.